So the esophagus has two areas that work as functional sphincters. In other words, they're not anatomic structures, but because they're closed most of the time, unless opened for a reason, they are effectively sphincters, right? So we have a top one, upper esophageal sphincter, that keeps air from going down. Okay, now in adults, air entry is not as big of a deal because adults are usually much better at getting the gas out from the top. But like in babies, their upper esophageal sphincter doesn't work very well, particularly when they're very, very little. So like one of the common causes of colic in a little baby is they cry. When babies cry, they swallow air. When they swallow air, they get bloated and gassy, which makes them cry, which adds more air. You see the problem, right? So it's a cycle. Their upper esophageal sphincters don't work very well. That's why we do the lovely burpee thing that we do with babies, right? To help them get that air out. Now, the lower esophageal sphincter gets a lot of attention in medicine. It sits at the top of the stomach, between the stomach and the esophagus. And it is supposed to be tightly closed because what's in the stomach is pretty nasty, right? It's high acidity environment. Now, the stomach has protections against that, but the esophagus doesn't. So when the lower esophageal sphincter is relaxed, that nasty stuff in the stomach tends to reflux up into the esophagus, and it causes inflammation and therefore pain. Heartburn, right? So typically these are supposed to be closed, but a lot of things that we humans like to put in our bodies relax the lower esophageal sphincter. Alcohol, caffeine, fats, spices, all of those things do, right? So if you wonder why you're having a bit of heartburn after the very fatty, spicy meal with which you had a margarita followed by a cup of coffee, could be that your lower esophageal sphincter has given up and gone home for the day, right? So you're just simply going to be sitting in the recliner and waiting for your food to move down, right? That we used to have medicines. There was a particular medicine that would tighten this up, that would constrict the lower esophageal sphincter. But then we found out that it creates heart problems, so we can't use it anymore. Right? So maybe there'll be another one. You guys can maybe go find another lower esophageal sphincter tightener. All right. So clearly the LES is going to play a role in the disease we call gastroesophageal reflux disease, or GERD.